Yeah, Mr. Administrator, one of the issues, and we talked about this at the rail derailment with the EPA official that was there, is the mixed communication as to what's safe and crisis communications that EPA has moved forward with. And if you don't have specific and detailed information, the gaps get filled with misinformation and concerning. So I want to ask you about, I congratulate you on finally setting the maximum, the MCL levels for PFAS. We talked about that. But at the same time, oh gosh, several months ago, you put out something called a health advisory level. The health advisory level is so low that it can't be measured. So nobody knows whether the health advisory level is safe or not. And so basically now you have two levels. You have a health advisory level, which is very low and unmeasurable, and then you have the 4 parts per trillion that you set last week, I believe, that was considered safe. However, when Assistant Administrator Rodica Fox was here, she said there's no safe level for PFAS in drinking water. This is a very sensitive, as you know, I mean, we all know, very sensitive issue across the country. And very grave implications on how do we fix it, yes, but on the health side, what does this really mean? How is that kind of communication helping the American public, the mom with the kids or those grandparents with the frail health or anybody who's drinking? How are they really going to know with the assistant administrator saying nothing is it, very low health advisory, and then the maximum contaminant level being slightly higher? How do you square that to the American who's turning on their tap every day?
Yeah. Well, thank you for that question. And this is it's been a challenge for risk communication for a long period of time. Obviously, whether it's lead, whether it's PFAS, the agency traditionally puts out what we call a health advisory level that really does follow the science and determine at what levels things are not safe. We put that out there because we want to educate the public, because there are actions that can be taken beyond those actions that can be taken by the federal government. So our standards are required based on what is detectable and then the technologies available to get them to that level. Just because something can be detected at a certain level and a technology can reduce it to that level doesn't mean that therefore it is 100% fully safe. And there is that gap there. And so there may be things that you can do as an individual or that a state and local can do to get even lower vulnerabilities or risk or exposure to that health advisory level.
So what I'm hearing you say is that the safe drinking level that you set last week is not really safe. Is that what you're saying?
Well, it is. What we're saying is that
So why would you set it there?
We've set a level that is more protective of public health, meaning we've set it at that 4 parts per trillion level because we can detect it at that level, and we have the technology to reduce it to that level. It is more protective than if we had not had a regulation in place.
Well, I mean, I'm glad that we have this MCL. I applaud it. I've been complaining for years that we can't get this level, and so under your EPA, you set the level, so thank you. Yeah. But you're really saying that, I don't know, now I'm confused, because what I'm hearing you say is, well, we set a level because that's all we can detect to, but we're not really sure it's safe. See, this is, if you're sitting at home thinking, well, what does that mean in terms of turning on the tap and drinking? And so I just think we have to be really careful what we tell the American. I mean, I went through a water crisis with having chemicals in my own municipal system. It's a crushing thing to live through and to try to figure out who's telling you the truth and what's safe and what isn't. And so I would just implore you to be, I don't know why you wouldn't want to be unified with your health advisory level and your maximum drinking level, so that people can be assured that your science is telling me that this is safe. So this is a discussion we need to have, because I do think it foments confusion, and I think it's difficult for water systems, but it's difficult just for regular folks to figure out, with everything in the news about PFAS, what's really safe in my drinking water, and am I using the best methods that I can use. So we can talk about it. I just wanted to say there is a lot